Nurse Aide Written Exam Cost. Question 1. Which of the following is an example of resident abuse? Option A. Respecting a resident's choice of clothing. Option B. Yelling at a resident who is slow to respond. Option C. Assisting a resident with meals. Option D. Encouraging independence in grooming. The correct answer is option B. Yelling at a resident who is slow to respond. Question 2. The nurse aide receives an assignment that is outside their scope of practice. The nurse aide should: Option A. Complete the task to be helpful. Option B. Politely decline and state the reason. Option C. Ask another aide to supervise. Option D. Report the nurse immediately to administration. The correct answer is option B. Politely decline and state the reason. Question 3. When a resident with dementia becomes agitated, the nurse aide should: Option A. Argue with the resident to correct them. Option B. Use a calm voice and try to redirect attention. Option C. Physically restrain the resident. Option D. Raise your voice to gain control. The correct answer is option B. Use a calm voice and try to redirect attention. Question 4. The acronym RACE in fire safety stands for: Option A. Run, alarm, contain, extinguish. Option B. Rescue, alarm, contain, extinguish. Option C. Rescue, alert, control, evacuate. Option D. Remove, activate alarm, contain fire, extinguish/evacuate. The correct answer is option D. Remove, activate alarm, contain fire, extinguish/evacuate. Question 5. Standard precautions require the use of gloves when: Option A. Talking to a resident. Option B. Assisting with feeding only. Option C. Contact with blood, body fluids, or broken skin is anticipated. Option D. Delivering mail to a resident. The correct answer is option C. Contact with blood, body fluids, or broken skin is anticipated. Question 6. A resident who has had a hip replacement should avoid: Option A. Using an elevated toilet seat. Option B. Crossing their legs. Option C. Lying on their back. Option D. Using a walker. The correct answer is option B. Crossing their legs. Question 7. The nurse aide is providing foot care to a resident with diabetes. What should the nurse aide avoid? Option A. Washing between the toes. Option B. Cutting the resident's toenails. Option C. Applying lotion to the feet. Option D. Checking the water temperature. The correct answer is option B. Cutting the resident's toenails. Question 8. A resident's intake for the shift includes 4 ounces of juice, 8 ounces of milk, 6 ounces of coffee, and 120 ml of water. What is the total intake in milliliters? 1 ounce equals 30 ml. Option A. 540 ml. Option B. 660 ml. Option C. 480 ml. Option D. 600 ml. The correct answer is option B. 660 ml. Question 9. When serving hot beverages to a resident, the nurse aide should: Option A. Fill the cup to the very top. Option B. Use cups with lids and verify temperature is safe. Option C. Place the cup on the edge of the table. Option D. Serve beverages in the resident's bed. The correct answer is option B. Use cups with lids and verify temperature is safe. Question 10. The nurse aide can help prevent the spread of infection by: Option A. Wearing the same gloves for multiple residents. Option B. Performing hand hygiene before and after resident contact. Option C. Using hand sanitizer only when hands are visibly soiled. Option D. Wearing jewelry on hands during care. The correct answer is option B. Performing hand hygiene before and after resident contact. Question 11. A resident is crying in their room. The nurse aide's best initial action is: Option A. Tell the resident to stop crying. Option B. Leave the resident alone without acknowledgement. Option C. Ask gently, would you like to talk? I'm here if you need me. Option D. Tell the nurse the resident is being dramatic. The correct answer is option C. Ask gently, would you like to talk? I'm here if you need me. Question 12. The purpose of restorative care is to: Option A. Do everything for the resident. Option B. Maintain or improve the resident's current level of function. Option C. Speed up the dying process. Option D. Eliminate the need for all assistance. The correct answer is option B. Maintain or improve the resident's current level of function. Question 13. A resident is experiencing grief after the death of a spouse. The nurse aide should: Option A, tell the resident to stay busy and not think about it. Option B, expect the resident to recover quickly. Option C, allow the resident to express feelings and listen without judgment. Option D, avoid the topic entirely. The correct answer is option C, allow the resident to express feelings and listen without judgment. Question 14. A resident uses a hearing aid. The nurse aide should: Option A, wash the hearing aid with soap and water. Option B, check the battery and clean the aid according to instructions. Option C, store it in a hot place to dry. Option D, insert it without checking the resident's ear. The correct answer is option B, check the battery and clean the aid according to instructions. Question 15. When preparing to transfer a resident, the nurse aide should first: Option A, lock the bed and wheelchair brakes. Option B, ask the resident to stand. Option C, remove the resident's footwear. Option D, disconnect the call light. The correct answer is option A, lock the bed and wheelchair brakes. Question 16. Which action is correct when collecting a stool specimen? Option A, take it from the toilet bowl. Option B, use a tongue depressor to collect a small amount. Option C, fill the specimen container completely. Option D, collect it after the resident has urinated on it. The correct answer is option B, use a tongue depressor to collect a small amount. Question 17. When feeding a resident with dysphagia, difficulty swallowing, the nurse aide should: Option A, use a straw for all liquids. Option B, feed quickly to avoid fatigue. Option C, follow thickened liquid orders and allow time for swallowing. Option D, tilt the resident's head back. The correct answer is option C, follow thickened liquid orders and allow time for swallowing. Question 18. The nurse aide is assisting a resident with deep breathing exercises. The purpose is to: Option A, increase heart rate. Option B, decrease oxygen levels. Option C, expand the lungs and prevent pneumonia. Option D, induce sleep. The correct answer is option C, expand the lungs and prevent pneumonia. Question 19. The nurse aide is cleaning a resident's room and finds a loose floor tile. The nurse aide should: Option A, ignore it. Option B, report it to maintenance and mark the area as a hazard. Option C, try to fix it with tape. Option D, move furniture over it. The correct answer is option B, report it to maintenance and mark the area as a hazard. Question 20. A resident has a nasogastric (ING) tube. The nurse aide should: Option A, remove the tube for feeding. Option B, position the resident flat during tube feeding. Option C, report if the tube appears dislodged or if the resident is coughing. Option D, administer the tube feeding independently. The correct answer is option C, report if the tube appears dislodged or if the resident is coughing.